Every weekday, something extraordinary is happening across the province of KwaZulu-Natal. From north to south, east to west, over an area about the size of Portugal, doctors and specialists from a range of disciplines are being flown to the outer reaches of the province, where they are changing lives, saving lives. This is a partnership of the Air Mercy Service and the KwaZulu-Natal Department of Health in action.
I must admit, I was one of the skeptics. I come from an activist background where we only spoke primary health care, and here these guys pitch up and say, we've got planes and we want to do healthcare, and I'm like, why waste the money?
But Chairman of the Board, Kovan Naidu, soon changed his mind when a health economic study independently showed that the province in fact saved money through its partnership with the Air Mercy Service.
Now to see the service there and see the kind of response we're getting from, even from government, from communities, from other organizations, from our volunteers, etc. It's just an amazing feeling.
Community service doctor Nipo Mangeni works at Bethesda Hospital. It's a long way from anywhere, on a mountain in northern KwaZulu-Natal. There are no specialists here, and despite his inexperience, he must solve many difficult cases alone.
Like I always say to my other colleagues, you become a master of everything. You become a doctor, a pastor, a counselor, almost even a teacher.
In the pediatric ward, this young doctor is confronted daily by childhood killers like HIV, TB, and pneumonia. He often needs to refer to a specialist, and that is where the AMS partnership is boosting rural healthcare.
The partnership with the AMS service is actually one of the brilliant initiatives that the department has had, because we actually can safely say that every citizen in this province has access to tertiary services.
Dr. Jeroen van Lobenstein is a specialist pediatrician on his way to Bethesda Hospital. His skills support 16 hospitals in a district of 3 million people. His main focus right now is the reduction of infant and child mortality in his district.
I think you must be a bit of an adventurous type. If you're like this really controlled person that really wants to spend exactly so many hours in a hospital, then you can't do this. Because it's always a surprise what the day is going to bring.
Today is a good day at the pediatric ward. Dr. Mangeni has discharged many patients. But these babies are his difficult cases. Their condition is not improving, and he values the advice of this experienced pediatrician.
We find that the community service doctors do not have supervisors. And therefore, if we have the flying doctor service coming through, they can then gain confidence as junior professionals, being taken and guided in the right direction.
In the past, the number of children under 5 dying in rural areas like these has been too high. This is a mortality meeting, and these doctors and nurses are working together to understand how a child death could have been prevented.
If you look at South Africa's situation, we really have to make a difference. We have been in an embarrassing situation as a country that we were only one of the 12 countries where the mortality rate went up in children under 5 years instead of down. So I think there's a good awareness, also with the current government, that we really must make a change.
And at Bethesda Hospital, these meetings and data capturing are already beginning to turn the tide, as medical manager Dr. Kelly Gate explains.
With the high HIV prevalence that we have, we're looking at sometimes up to 50% of the population HIV infected, and that just adds to the burden of the disease that we're seeing, and a lot of children under the age of 5 years that are dying. Since the introduction of sort of these consultant visits, I've noticed a drastic drop and probably about a 50% reduction in the mortality with the sort of regular consultant visits.
We had the option of doing the conventional model of going in, do it, and feel good about ourselves and leave. We didn't go that route. We went the route of saying we'll take people, we'll go and provide services, but we'll train the local doctors, the nurses, and impart the skills so that those institutions become stronger as a result of our efforts. And I think that's built a lot of goodwill.
At the heart of this operation are the pilots. AMS decided that they could make a difference here too and initiated a pilot development program. 5 trainee pilots are still undergoing the 2-year training. Already, 3 captains have emerged. Lebo Manganya is one of them, and every day he takes off, he soars above his boyhood dreams.
Initially, I wanted to be a doctor, but then came flying. I went to a science expo in Sarukan Air Force Museum, and I fell in love with the technology of flying, and then this is where I am now. 5 years later, I'm doing it and loving it.
Lebo dreams of one day flying the A380, but for now he is building hours and confidence. Flying through storms and landing on remote airstrips is all in a day's work. It's another busy morning at the Durban base of AMS. Lebo is taking ophthalmic surgeon Dr. Naren Chetty to Dundee Hospital. Several hundred kilometers away, his patients have left home early and are eagerly awaiting his arrival. News of the success of the cataract operations has spread far and wide, and these old people are hoping to have their sight restored.
By the
time Dr. Chetty's day is over, he will have performed almost a dozen cataract operations. It may be tiring, but he finds his outreach work hugely fulfilling.
Outreach is very important because lots of patients don't have access to eye care, and I think lots of patients just go blind silently.
Maria Khumalo is one of the first to go under the knife today. It's not always easy to watch surgery of this nature, but with steady hand and extreme concentration, Dr. Chetty removes the cataract from Maria's eye. In a matter of hours, her quality of life will be restored. In the hills around his home in Pongola, Buti Magagula's progress is slow. He lost his leg in a car accident and has just returned to work. Today is the final fitting of his prosthetic leg. For him, the flying doctors are a blessing.
Hey, you see, man, this thing that they are doing, man, is very nice for us. Because we are from these poor houses, you see. Got no money just to travel down Durban, you see.
It takes under an hour by air from Durban to Pongola in northern KwaZulu-Natal. Bad roads highlight just how difficult it would be for doctors to drive to these remote hospitals. Shane Olsen is a prosthetist who usually sees about 15 to 20 patients.
And it gets rid of all the fluid.
But today, he has set aside extra time to assist Buti.
Yeah, I know you're nervous. I can feel you shaking. Relax. Okay. Okay. How does that feel now? Now we're going to go 90 steps.
Yes.
Small little steps. Baby steps. Baby little steps. Okay. We don't want to see how fast we can go today. We'll do that later. Very good, my friend. Okay. When you put your weight on this one,
yeah, it's a good day for me. Because to get me walking again. I was telling my child, man, I said, man, you are got the luck because you're going to dance with the father again.
After 24 hours, Dr. Chetty returns to his cataract patients to remove the bandages. Petros Ngladla, who couldn't see his cows and stopped going to weddings because he was blind, is now able to see. The cataracts once blocking his vision are gone. Gertrude Zulu is overjoyed. And once again, Maria Khumalo will be able to see her pension money.
How?
Yeah, I think it's very rewarding. I think once you see things, it makes it all worth it, I think.
Scenes like this, says Dr. Chetty, are not unusual.
With HIV, many of those go-go's are now the breadwinners in their families. They are running households. You know, when you hear the stories behind the story, behind the smiles, those things actually make us more and more convinced that what we're doing is the correct thing and that we need to expand these programs and make them grow right across the country.
The AMS are justifiably proud of the Flying Doctor Service, but that is not all this non-profit NGO does. They also have a fully equipped 24-hour air ambulance, complete with a mobile ICU in 3 different provinces. The homegrown medical interior and their specialist knowledge are now in demand internationally.
We've been approached by even India and other countries in the Middle East to now advise them on their services. So we really want to be much bigger than what we are. Obviously, our priority is to firstly serve the various provinces of this country, but I do think we have a much bigger vision.
The AMS and their provincial partners are establishing a national footprint across South Africa. Air ambulances and rescue helicopters can be found wherever the need arises. They often go to the assistance of many accident victims with no medical aid. From their head office at Cape Town International, AMS are creating a national aeromedical service that is accessible to all. And it is through the financial commitment of the provinces that this is sustainable. The Cape Province on the southern tip of Africa relies on the AMS for inter-hospital transfers and rescues.
30 minutes to Tiger. I don't have it right on me. Can I 30. You did confirm they're not going to...
The National Operations Centre at head office deploys the planes and choppers across the Western Cape. But weather can frustrate even the best laid plans. At Chapman's Peak, a man taking photographs has fallen to his death. Not knowing his fate, a friend has gone in search of him, and she is now trapped on the rocks far below. The Air Mercy Service has sent in the chopper, but high winds could smash it against the rocks. Undeterred, AMS send in their volunteer ground crew instead.
Everybody that works at the AMS goes the extra mile to get to the patient to the most appropriate facility, to get them off the mountain, to rescue them, to give them the best possible medical care that they can receive.
Lifting in 3, 2, 1.
It's bittersweet for the AMS team, as one life is lost and another saved. Behind every rescue, intensive training takes place. The Air Mercy Service offers various training courses in aeromedicine to their crews, partner organizations, volunteers and the public across most of South Africa.
18 Echo, 18 base, we've got a drowning in progress, drowning in progress.
This is a sea training exercise of the Air Mercy team of pilots, volunteers and paramedics. Advanced life support paramedic Andre Olifant assists with the training.
Training is as important to us as doing an actual rescue. We operate on a very thin line with very thin margins with very little space for error.
To avoid downtime and reduce costs, the Air Mercy Service has brought the maintenance of their fleet in-house. Pilots have full confidence in their machines when they leave the base. The team at this humanitarian organization often sacrifice higher salaries for the love of assisting others. Ifan Blake is a senior rotor wing pilot.
I love aviation, I love helicopter flying. It's something I've wanted to do since I was a kid. And I think the most rewarding application is saving people's lives.
Evidence of the skill of these pilots can be seen in the mountains where they come perilously close to the cliff faces.
In terms of rescue, there is no other organization, no other company aside from the Air Force in South Africa who is able to do the technical rescue that the AMS does.
As this national aeromedical network spreads across the country, these crack teams will go to the aid of anyone in need. And that is what happened in the mountain range just outside Cape Town when this training team received an SOS.
You've got a rescue call, suicide call.
The private companies refused to airlift Corinne Rayson because she had no medical aid. But the AMS, as a non-profit entity with no shareholders, refuses no one. So when she severed a vertebra, the Air Mercy Service didn't hesitate. Rescues like these happen all the time thanks to the partnership and significant financial contribution from the Cape Provincial Health Department.
I was just overwhelmed by their efficiency and professionalism. And I'm very grateful for the help they gave me that day.
This collaboration between provinces and the Air Mercy Service has become a national asset. They have expanded to 9 bases countrywide. 7 fixed-wing planes and 9 helicopters fan out across the country, providing quality emergency healthcare. Now they are striving towards the participation of all the provinces to ensure a sustainable national aeromedical network for all South Africans.